The views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online is a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users. On demand on iTunes and on YouTube and on my site, GaryBaumgarten.com, where there's a great conversation about the G20 and how Paltalk could have prevented violence there today. I'm not kidding. We'll talk about that in the second half of the show. And thanks to our good friends at CRN Digital Talk Radio, we're syndicated to an additional 12 million households. I am your host, Gary Baumgarten. I welcome you to the show. Well, this is a very interesting story that I'm going to present to you, and I know it's April the 1st, and you may think that I'm playing an April Fool's Day joke with this information that I'm about to impart upon you, but I assure you that I am deadly serious about this information. If I asked you what was the leading cause of death in children under 5 in the world, you might answer AIDS, malaria, or measles, but I bet that you'd be surprised to learn not only were you wrong, but that the biggest killer is pneumonia. Yes, pneumonia, and that it claims more children than the other 3 diseases combined. Over 2 million children die from pneumonia each year, accounting for almost 1 out of 5 children under 5 deaths worldwide. This despite the fact that the antibiotic treatments cost only 20 cents a dose. This is without a doubt the most underreported health problem in the world. Amazingly, until this year, there had been no international day to bring global attention to the crisis. But on April 7th, the first World Against Pneumonia Day will be launched. Organizers believe that it's time to stop the world's ignorance of the largest killer of children. Joining us now on News Talk Online on Paltalk.com to discuss the World Against Pneumonia Day are Mary Beth Powers and David Marsh of Save the Children USA. Powers heads Save the Children's Survive to 5 campaign, which seeks to increase understanding and find resources to fight problems that result in the deaths of 9 million children annually. I'm a little confused about the figures. I'm sure our guests will tell us about that. I guess not just pneumonia, but other deaths are included in that 9 million. These deaths are from preventable or treatable causes. Marsh is an international public health physician who has worked with Save the Children for 14 years, currently as Senior Child Survival Advisor. Dr. Marsh and Ms. Powers, welcome to News Talk Online on Paltalk.com.
Gary.
Great to be here.
Great to have you, and if you can pump up that volume just a little bit more, that would be great so the folks out there can hear them a little bit better. Tell me, if you could, Mary Beth Powers, why it is that this is such an underreported illness. I had no idea before it was recently brought to my attention by a mutual friend of ours that pneumonia was killing so many children worldwide.
I mean, among experts, we all know that this is the leading cause of death of children under 5 around the world. But there really hasn't been much noise created about this. There have been coalitions that have come together around, diseases like AIDS and malaria. But in fact, the number one killer of children, pneumonia, really hasn't received the same kind of attention. And that's one reason why we'll be launching this effort on April 7th, which is actually April 7th is World Health Day. And we'll be asking the United Nations to create a World Pneumonia Day in November, which is really when sort of the peak season for pneumonia cases occurs.
I see. Well, here in the United States and in other developed countries, Dr. Marsh, I guess pneumonia is considered easily treatable. Apparently in developing nations, not so.
Well, that's right. The causes of pneumonia are diverse. You can have the common ones would be a virus or a bacteria. And most pneumonia in the USA, for example, is viral, and most of it is minor. Sometimes it can be very severe, even though it's viral. In the developing countries, it tends to be bacterial, and often with a blood-borne component, and these kids can get very sick very fast, and without antibiotics can die. Do die.
And what's very sad is the statistic, the fact that I read in my introduction to the two of you, Dr. Marsh, that these antibiotics are only 20 cents a dose, at least, I guess, for in the pediatric dosage, right?
Well, they're definitely inexpensive, and the great news is, cotrimoxazole, which is often known as Bactrim or Septra in the States, is a pretty good pneumonia drug, and amoxicillin is even better. And these drugs have been around for a generation, and they're generic and not expensive at all. Definitely, a baby can be treated for less than $1, and sometimes for 20 cents, as you mentioned. It sort of depends upon the local pricing and the formulation that's available in the country. But the point is, even poor countries can pay to treat their kids with pneumonia.
Well, even poor countries can pay, but some of them really are strapped, of course. I want to ask Mary Beth Powers, also from Save the Children, what exactly is being done in the developed world to raise money and get these antibiotics in the hands of physicians in developing nations to save the lives of more children?
Well, one of the critical things isn't just the drugs. It's actually about training community health workers who could help parents recognize a case of pneumonia and then seek treatment. So you have, first of all, you have the problem of parents not realizing how severely ill the child is. And we have demonstrated in the field that health workers, sometimes with just a 6th grade education, could learn to recognize rapid breathing, chest indrawing, the kinds of symptoms that you might see in a young child with pneumonia and fever, of course, and then you could diagnose that is presumably pneumonia and encourage treatment right on site or referral to a local clinic for antibiotics. And that's the really critical thing. Getting the drugs out there is also an important part of the answer, so the supply chain is critical, but it's actually the human beings who can help parents recognize pneumonia in the young child that are a critical part of what Save the Children is doing in our Survive to 5 campaign, training community health workers around the world to recognize illness in young children and helping parents seek proper treatment, because no parent wants to see their child suffer. But often they just can't tell what the problem is, or it's misdiagnosed, and that's what leads to death, because as Dave said, some of these kids get sick very rapidly, and then there isn't time to treat, or it's a much more severe case, and it's much more costly to treat.
Okay, and I'm being told that we hear you real well out there, Mary Beth Powers, but Dr. Marsh,